Is the government's plan to hike tobacco tax by 10% a year until a packet of cigarettes reaches $30 racist? That's what anti-smoking campaigner Dr Marewa Glover believes. The Massey University Associate Professor of Public Health says tobacco tax increases aren't cutting Maori or Pacifica smoking rates, just Pākehā. I asked her, given she supported tobacco price increases in the past, why she's had a change of heart.
Because it hasn't worked in the last 9 years, so no significant drop in Māori smoking prevalence or Pacific prevalence since 2006.
So you're saying that your support for the tobacco price hikes was only based on, the results they've reduced for some groups. Who's winning and I guess who's losing?
Pākehā women seem to have dropped their smoking prevalence rates. They're the only winners, really. Younger people, we seem to have delayed uptake for them, so they slow down in terms of uptake but take it up later.
And so based on those results, you're saying that the policy is racist or biased towards certain groups of people?
I think that what I was saying was that policies have a differential impact, or we certainly should be looking at policies if they are having a differential impact, and in this case the tobacco taxes are a regressive policy. They do hurt people in the pocket. They are disproportionately going to hurt Māori and Pacific, who are overrepresented among the lower socioeconomic and among smokers. It's just not fair to keep doing that, especially when it's not working.
So no signs it's working at all for Māori or Pacifica people?
It depends on what statistics you use, and I think that the Māori Party have not been provided with all of the information. So the statistics on the Ministry of Health website show no significant drop in smoking prevalence, whereas the census, which is done less often, is not as robust. I mean, yes, it's a lot more people, but that one showed that we had a drop in the last census. But the health survey is showing no drop. So it depends what you look at. And in the end, it would appear, no, it's not working. So don't keep doing the same thing.
So, Marewa, are you all for scrapping the increases? Because, what they're saying is that by 2020, a packet of cigarettes will be $30.
Well, what are people supposed to do? They're going to keep putting the price up, but it's not going to stop them smoking, so then it just becomes a money grab. It's not helping reduce Māori smoking. Where's the help? They need to bring in the help, and that would be, in my mind, the nicotine for vaping. So if we have electronic cigarettes, nicotine legal for sale and distribution in New Zealand, then at least people have something to switch to. But at the moment, that's banned as well.
The Ministry of Health in 2015 said that there wasn't enough evidence for them to be able to recommend e-cigarettes as an aid to quit. What do you know about them? How do they work?
The e-cigarettes are much easier for people to shift onto. The other thing is that they're far more attractive, so it's actually something that smokers are seeking out themselves. They're willing to pay for it themselves, and the UK have seen a huge drop in the numbers of smoking, lots of people switching to e-cigarettes. They're far more progressive over there. They're looking at the same evidence that the Ministry of Health here are looking at, and Public Health England is saying these are 95% safer. We should be recommending that every smoker switches to e-cigarettes.
And just finally, last week, Marama Fox and Sam Lutuenga at the budget release said that these hikes on tobacco were, quote, the single most powerful tool to reduce smoking. They're both Maori and Pacifica. Do you think, what were they saying? Were they making that up?
No, they're being misled. They're being given advice by predominantly Pākehā academics who want a smoke-free New Zealand. They have their particular goal in mind. It'll be smoke-free for Pākehā people, but that's not what's happening for Māori.